Welcome to Frontline Nursing, a NurseMinder production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you're considering nursing as a profession, you're currently studying nursing, or maybe you're a nurse in transition, this show will give you some behind-the-scenes information to help you guide your career. Today's episode is all about working on a general surgical unit in an urban hospital. This nurse specialty focuses on providing direct patient care to adults pre and post surgery with both acute and chronic conditions. It is a fast-paced environment that will keep your feet hopping. So get those note apps and pens and papers ready because it's going to be a good one. Today on Frontline Nursing, we are joined by Aidan Cochlin, an LPN who has been working since 2017 and is here today to share about his journey working in a surgical unit. Welcome to the show, Aidan.
Hi, guys. Hi there. I'm excited to be here.
Yeah, I'm excited to have you here. You are actually the first nurse who is of male gender. I didn't want to call you a male nurse.
That's great.
I know, so I'm really excited to kind of get a little bit more of the perspective from the other gender that supports us in the workplace.
Yeah,
because
the other
I
half
think there
of the
can
population.
be some things, yeah, exactly, right? So as always, I like to get started with just learning a little bit about you and sharing with our listeners, how did you find your way into nursing? So why nursing?
So, I've always, since high school, I've been working in some kind of service industry. So I worked at a restaurant for a long time. And establishing rapport with customers, same as patients, it's a very people-oriented profession or area. So I just interacting with people, dealing with people in their many facets, in their many moods, keeps things exciting. I've also in high school I took all of my sciences that really interested me, and I did particularly well in biology. And the human body has always fascinated me. The little quirks and how we've learned over, the many years to help it along to get where we needed to go, right? Whether that be surgery or medications or what have you. But what really, I think, drove me to nursing is I have a particularly close relationship to my grandmother. And, kind of taking a step back from over the years, and she's getting older, and she's still very much independent, and she takes care of most of more people than she probably should, even at her advanced stage, but still completely independent. And I knew that one day that I'd want somebody might have to take care of her, and I kind of wanted to maybe not represent, but as in put out a good example to somebody that I would want, or that I would feel comfortable taking care of my grandmother or my mother or whoever in my family, and represent the profession that's amazing in what it does, and how it guides people through their journey of recovery or treatment.
That sounds really inspirational. Throughout the service and kind of always knowing you wanted to be a part of service somehow, that your grandma, even though she was healthy, kind of motivated you to move towards a position where you'd be able to support her when she needed it. Mm-hmm. Your grandma should be proud.
Yeah, even to this day, I tell her, like, if you ever need, a hand with anything, whether it's my grandfather who lately, or my step-grandfather who has lately been slowly declining a little bit cognitively, I'm warning her about things I've learned either through my profession or at the hospital, like caregiver burnout, and signs that could point towards his condition worsening or whatnot. Obviously, I'm not a doctor, but just
You're darn close things. Though nurses are pretty close.
we help them out for sure.
We are the eyes and the ears. So
yes, exactly. We're the hands that do the work. You know what I mean? Do the
absolutely.
Gritty.
Yeah,
for sure.
Yeah, we need doctors. Obviously, they go hand in hand with what we do, but we are there 24/7, and we can certainly pick up things quicker because we're there.
For sure.
So very interesting. oddly enough, I actually had a dream, just because we're talking grandmas. I had a dream last night and my grandma was in it, and I haven't dreamt about her. And she passed in 2010, I believe it was.
Oh,
this is the first time she showed up in my dream, and man, she was having a good time. So
was she good?
Shout out to grandmas. Maybe that was the theme. I don't know. Maybe that was just kind of preempting me that we're going to talk about grandmas today.
For sure, yeah.
That's awesome.
Yeah,
all right.
they
You had mentioned caregiver burnout, and that you're kind of aware of some of the signs and symptoms so that your family knows, so that they're not becoming burnt out as a provider of someone in the home. Are you experiencing, or have you seen anybody experience or go through that in your current unit? Like, I know you've been nursing for 2 years, but it's a grind sometimes, and burnout is real.
It is very real, and I've 100% not afraid to admit that I've 100% experienced burnout in one way or another.
Already in your short career, yeah.
Oh, absolutely. Funny enough, it's kind of almost a running joke on the unit. Like, my first 6 months of my nursing, I ended up in a temporary full-time position for 6 months. And for whatever reason, I'm not sure if I just need a few more horseshoes somewhere or some clovers, but through no fault of my own, the patients, the situations that we were put in were difficult and draining and time consuming. So really finding a self-care strategy or some kind of safe space for yourself and being able to confide in your team really makes a difference, especially for new nurses, even experienced ones that are, whether the unit's going through a lot of change. Because, I mean, for example, the Connect Care coming up, the Connect Care rollouts just recently, I'm sure have put a lot of strain on, providers at every level.
Yeah, change is not easy, especially something so, I mean, that's like all encompassing. You can't do anything without Connect Care now.
Exactly, right. And I mean, working our way up into, into the intro of that, because our unit hasn't integrated any of it yet, but it's coming.
Right, and this is the online charting system, just for those who are listening maybe from another place, so they know what we're talking about there.
Yeah, but yeah, 100%. Stressful situations are going to happen, almost whether you like it or not. Doesn't matter what area you're in, but being aware of the stress that it puts on yourself and how you're feeling, and being able to work through those feelings instead of putting them off, really make a difference. I mean, venting, completely necessary in this perspective.
And normal and healthy.
Absolutely.
Doing it in a very respectful and responsible way.
Yes, absolutely. Yeah. Right place, right time as well, right?
That's right, yeah.
Yeah.
Let's dig into that burnout just a little bit more, because you had mentioned your first 6 months was a temporary full-time position, and there were some difficult situations, some hard maybe patient scenarios. 6 months, you're fairly new, and you're just still climbing that knowledge ladder. They say it takes 2 years for a nurse to feel comfortable, and you hit the floor running, and there's so much to learn every day to build your competence. Do you think that was a part of the reason you burnt out, or was there maybe just tell me why you think you felt you were kind of on that path to burnout?
So, I mean, the learning curve, absolutely, because as a new nurse, you're assigned you get your license. It's so exciting. You pass the CPNRE, and I think, like me personally, I got on the floor and kind of thought, okay, I'm expected to know all of this information, and your educator's handing you PowerPoint slides and readings and journal articles and teaching sheets for patients and all that, and you just have to try and absorb as much as you can, right? And I mean, I find the best learning happens by doing.
Yeah, I'm the same way.
So I mean, even there's been many situations where it's like, I'm talking to patients and I'm like, I haven't actually encountered this surgery very often. Let's go through the teaching sheet together, because I'm going to learn a few things too. But absolutely, you know, as a new nurse, you can't be expected to absorb all of this information all at once. So, I mean, your head's just, you know, it can overflow and you lose some of that info, right? But, you know, difference in hours, depending on what you were doing as a profession or as a job, part-time job before that as well, was a contributing factor. So, I mean, I work 12 hours.
You mean?
Days, nights. So the full-time and the full-time that I'm in now is 4 weeks of days, 2 weeks of nights, no matter what, rotating, right? And it's 7 to 7. So 7 a.m. to 7 p.m. So, I mean, in the winter, you go home, you get to work in the dark, you go home in the dark.
Yeah.
Doesn't matter what shift you're working, right?
Even if you're working 8-hour shift, you go home.
Yes.
In the dark.
Exactly. Because we live in Canada. Because we live, and in Edmonton particularly. But yeah, whether it's stress from the difference, getting used to the difference in pace, you know, getting used to doing, you know, being handed patients with dressings or skills involved that you've never done before, you know, packing, wound vacs, anything like that, can absolutely feel like the world is, or these patients' world is sitting on your shoulders for that 12-hour shift, right?
Well, and when you're new, everything takes longer. You still have the same assignment, but everything takes longer because you're thinking about it. It's like when you first learn to tie your shoe, and we kind of forget that when we come into a new profession. And we do tend to have high expectations for ourselves. You just graduated. That means you know everything.
Yeah.
For those who are listening, I'm air quoting.
Yeah. Yeah.
And we don't. And I had the same pressures on myself, Ian. I was 35 or something when I graduated. And because I was a maturer student, an older student, I had higher pressures on myself, I think, because I thought I should be farther ahead. You know, I should be where that 20-year-old was 15 years into their career, but really I'm starting out as that brand new nurse, right?
Yeah.
Very difficult. So for sure I can hear a piece of that. I almost sense, are you a bit of a perfectionist?
I try to be.
Yeah.
I try to make sure that if I leave, that the person taking over for me won't have to fix what I've done or you know, or change it completely. I also want to make sure that the patient is comfortable or satisfied with what with what was applied or happened.
Yeah.
And I mean, because at the end of the day, the patient's either going to be wearing that dressing for, with a wound vac, sometimes 48 hours, 72 hours, right? So at the end of the day, the patient should have the last say, right? If it's uncomfortable or if something feels wrong about it, then I want to make sure that somebody doesn't have to come and sweep that up for me. You know?
Yeah. And I sense that part of that pressure of being new in the first 6 months and learning all this stuff and feeling the weight was that you were having a hard time living up to your own value and image of what a nurse is supposed to be.
I think so. I think we, you know, going into the profession, I mean, getting through nursing school and having all of those ideals, those, you know, high bars that are set for us, which, I mean, is great, but I mean, you get to real world nursing and sometimes it's skewed or sometimes it's not realistic.
Yes.
For that patient or for that in that very particular situation, right? And I mean, learning how to deal with difficult people and difficult situations, I found in that first 6 months, I used a lot of personal reflection. And I mean, you know, you write all these personal reflections in labs and for your preceptorships and all that, and you really don't realize how often you do it on your own after a long day. Like, you know, maybe I could have said this, or maybe I said this the wrong way, or you know, this dressing was difficult, maybe I'll try this next time. So I mean, and that can help you sort of debrief yourself after some of those difficult days, right?
Mm-hmm.
But just know as a new nurse that everyone has those days.
Oh,
Every
absolutely.
single person, no matter what area you're in, there's going to be days where you're off, or the situation happens that's beyond your control, and just working through it. You know, don't bottle those feelings up, because I mean, even personally, I have had not meltdowns, but when you get home and you think about your day and it just all comes out, which is good release. But
It is
having
good, really.
somebody, either family, friends, or even coworkers, especially coworkers, because they're going to be in that situation with you, right?
Well, and they're going to
So,
understand the world in which you are feeling stressed in, because they've been there too, right? So they've walked it, they've gone home and cried as well. And just to know that you're not alone and others are
yeah.
struggling some days as well is really important to remember.
I think that's a really important part of my journey on this unit, especially. The team, I want to say I go to work every day, and I know for a fact my team is going to be there for me no matter what, which, I hope every other unit is like that. But I go to work and I look forward to working with the people no matter who is on shift.
And that's a tribute to the nurse manager, because they are certainly responsible for starting to establish culture. And then the others who are there who want to buy into that culture and really adopt that supportive environment. So kudos to your manager if she's listening. We won't say any names, but
Yeah.
she'll know who she is, or he. I guess I shouldn't assume a female. That was really wrong of me.
Yeah, no, that's okay. I won't say anything.
Especially, I know. Oh my gosh, right? Okay, I want to stay on the burnout theme for a few more minutes.
For sure.
Because I feel like there's a few more elements in there, and I really want to expose and uncover some of those pieces, so that if there's anybody else feeling it, they can connect to your story, or they can see a little bit of themselves in you. So we have the new nursing struggles, brand new, high learning curve. We have the expectations of yourself as to what a nurse should be. And so on top of just learning your job, there's so much more that you're probably thinking about and doing at home in terms of research and reading and prepping and reflecting. Now let's talk about the patient assignment and how that can influence your sense of accomplishment or feeling burnt out. Was there anything in particular, of course, maintaining confidentiality, we won't say anything that's going to breach that, but can you maybe give an insider's view into what a day would have been like for you when you were struggling?
So, I mean, my average assignment for a day shift would be about 4, maybe 5, depending on the acuity, right? 4 or 5 surgical patients. So that could include anywhere from missed breast surgeries, maybe a simple cholecystectomy or an appendectomy, up to a complete abdominal perineal resection, with new colostomy creations, and all that. So I mean, there's quite the spread, quite the variety. We get thyroid patients as well. So I mean, and head and neck dissections. So I mean, just the spread of knowledge. Sometimes coming on as a new nurse, you're going into every room and you're like, okay, this is a completely different patient. What am I looking for, and what am I, going to be focusing my assessment on? So I mean, that plays a part of it. Having to recall some of that information for a completely different person, right? One thing that I found that, I mean, I'm not sure if that's kind of like a personal challenge or personal quality, but when I heard, about, say, patients with complicated dressings or what have you, as a new nurse, you're almost like, oh, I hope I don't get assigned that patient, because either you're afraid to fail, or it involves a lot of work and you don't want, in your head, You don't want your other patients to not suffer for that, but kind of be put on the back burner because you're prioritizing this other patient. But I mean, that kind of rolls into being a new nurse, and being able to depend on your team to guide you through that, and really practice those hard skills in the beginning when you have that support. When you are a student, or you're a preceptor, or you're a newer nurse, you have the educator there to to help you really get your teeth into those difficult dressing changes, or pathology kind of processes. For example, I mean, the prime example that I'm thinking, so I had 3 other patients, and then they were pretty simple, and I had one patient who he was obese, diabetic. He had come in with necrotizing fasciitis to his abdominal wall, to the point where he was we were doing saline soaks once a day, and you could literally put your entire forearm worth of to pack to the deepest part of this wound.
Yeah, neck fascia.
So I mean, as a new nurse, you're walking into this room, you're like, oh my God, I have to change this?
Yeah, because up until then, all you've done are like some little foot wounds and maybe a sacral wound.
Yeah. The nice, clean, well-approximated surgical incision. You're like, oh, wow, I feel so accomplished, because I cleaned it and slapped a meat pourer on there, and woo.
Took me all 5 minutes and I'm out of here. Woo, check that off.
Yeah, exactly, right? But I mean, it got to the point where I was assigned this man for, I want to say, really consistently for like 3-4 weeks.
That's a long time.
And I mean, he was there for a long time too, between saline soaks and wound vacs and all of the antibiotics that we've switched and tried and all that. But nothing beats the pride when I discharged him to an assisted living facility, and his abdominal wound was basically closed.
Wow.
So I mean, yes, those first 6 months were, they were difficult, and they were a grind. Like you said, there was lots to absorb. But you get to that point and you're like, you know what, I can do this. And you slowly get comfortable with the idea that you're new, but you might bring something to the table, to the team.
Absolutely. There's a lot of shock factor when you start to get into those deeper cases. As students, not that we keep students away from complicated cases. I love putting students with complicated cases, but just hearing your story, and I'm already like, I can see their thinking process of, oh my God, I have to know what this pathology is. I need to know what these medications do. I need to know what kind of wound dressing this is, and why am I using the saline over water, and all the elements that I have to think about is so consuming that critical thinking, and it's normal, critical thinking develops as you go, but there isn't space for critical thinking because they're still learning to tie their shoes.
Exactly.
Very overwhelming. Yeah, so interesting that you felt that right away early out of the gate. So it speaks a lot to maybe the acuity of the floor. I'm sure you had a great mentor, and that they felt comfortable putting you on as a single, like, you are the nurse, you're free.
Yeah, exactly.
And while that day feels really exciting and you're proud, you're like, yes, I'm the nurse. Then the next breath you're like, shit, I'm the nurse.
Exactly. Yeah. Like, oh wow, yeah, I have to make sure this person gets to the bathroom and back, even though they've only ambulated this first time, or that kind of thing. It's like, not that their lives are in your hands, but they're depending on you too, right?
Yeah, they kind of are. Yeah. It may not be like life limb I, but they are leaning on you.
Yeah, absolutely. Yeah.
Fascinating. We haven't even touched the emotional piece of burnout. And we haven't talked about the family members and how that might contribute to the feeling like you're overwhelmed and less capable and wondering, why am I in nursing? So maybe we can just touch on those 2 pieces, and then we can move on to the other stuff we want to talk about.
For sure. Yeah. So the emotional side, seeing, so for a couple examples that I'm thinking of, there was a couple patients that have spent a long time, whether like on the unit, whether because of repeat surgeries or complications, or what have you, but really they become part of the unit almost. So it's something, as tragic as, them passing away or something, it takes a piece of you, right, emotionally. And some people, I shouldn't say some people, there's kind of the idea that when you're in the medical profession, you have to detach yourself a little bit, which, in certain cases that really does, it's for the best. But when you spend 12 hours a day for example, like 6 months with this person, then, you get to know them, and, you get attached. But even spending a morning with somebody, for example, my first 12-hour day shift, I got to know this older gentleman and his wife. And he had a rough go. He ended up having bowel surgery. He had a pacemaker already. So he had quite the history, and he already been through quite a lot. And in the morning, the doctors, his blood work came back, and x-rays, CTs, it seemed like he had been starting to turn a corner. So, getting to know them, and he was pretty funny. I remember that. He would crack jokes while he was trying to get up to the bathroom. So me and a healthcare aide helped him to the bathroom, and it was about noon. And walking him back to the bathroom, he felt really weak. So to the point where we sat him down at the foot of the bed. And it was a little awkward, but I'm like, if he can't walk to the side of the bed, let's just boost him. We'll do some vital signs, see what's going on.
Mm-hmm.
We laid him down, and his wife was sitting in the corner, in the recliner, while me and the healthcare aide were there. And me and this healthcare aide boosted him up, and I looked at him because he hadn't said a word, and he was already starting to gray.
Oh, wow.
Yeah. So I'm like, and this is my first 12-hour day shift on my own.
Yeah.
So I told healthcare, I'm like, I knowing his code status is an M1, you need to go get somebody right now. So I put the blood pressure cuff on, and started, listening and trying to wake him up, sternal rubbing. But the whole time, what I was thinking about also is his wife is in the corner, and the shock, the surprise, and the sadness, I'm sure, and the horror that she would be feeling at watching her husband, something happen to her husband. I could not even imagine that happening to somebody that I love, in this, and sitting there in the same room. Not the charge nurse. It was our acting unit manager at the time, went in right away to see her, and to kind of stand there with her and be with her. And just being aware of that emotional, because these are people's families, right?
Absolutely.
Being aware of that emotional aspect of being in the hospital is really important not to forget. And the emotional impact that had on me as well, trying, and as a new nurse, again, you're thinking, what was I looking for? Like, did I miss something? That kind of thing.
Wrong.
Exactly. Yeah. Because as bad as it sounds, that's the first thing you go for, right?
Of course.
In this profession.
And you were able to resonate with your concerns for her feelings, because I imagine you were feeling some of those yourself.
Absolutely. I was 100%. I was freaking out. Freaking out.
We all go through that.
Right. Yeah. And so we called a rapid response, because he was an M1.
Yeah.
And he was, by the time we had boosted him up, he had passed away. I think there's a massive
heart attack, or
yeah. So, I mean, and that just kind of goes to show how quick things can happen. But, I've been through that situation in my head, and with, talking with my coworkers and stuff, over and over and over again. And, again, when we were talking about venting and, working through our feelings, it's really important to debrief yourself after situations like that. Because if you leave all those emotions like in the room or, at work, they follow you for sure, right?
Yeah.
You're supposed to, as a nurse, you're supposed to be calm, cool, collected, which I want to say most of the time we're pretty good at, but you're only human.
That's right.
So you've got to let yourself work through those feelings because you've felt them. You just have to acknowledge them, right?
Yeah, and two things. You probably felt really chaotic on the inside. I am sure on the outside you looked like you were in control because you were doing something. And the second thing is, if you don't know what to do a set of vitals, because that focuses your attention and it gives you time to think about, what do I need to do here?
Yeah.
So as soon as you said you put the blood pressure cuff on, I'm like, aha, do a set of vitals. I tell everybody that
right?
one. Yeah.
Exactly. And I mean, it was funny. I mean, I'm laughing about it now. The healthcare aide went to get one of my coworkers. One of the RNs came into the room. So I'm explaining what's going on, and she hands me a stethoscope. She's like, "Okay, well, listen for the apical." And it's so funny because I'm auscultated. I'm like, I just can't hear anything. I can't hear anything. Like, do you want to try? Like
that's what her point was. Yeah.
Right? And you're looking for that. But I mean, there was no apical, right?
Yeah. But because you anticipated it should be there, you felt like even you weren't doing that correctly. Is that
for sure? Yeah.
That's a significant moment, especially on your first day. And that's a moment that some would maybe make some nurses, that's it, I'm never going back, because they wouldn't be able to get over that feeling or that doubt or those questions. And so I'm really glad you had a strong team to help you work through that, because you're a specialist nurse.
Yeah, I always look back and I always thank my my team, my coworkers, and I continuously tell them, like, you guys keep me going. And I couldn't be able to take care of people the way I do if I wasn't.
Yeah.
It kind of made me into the person that I am.
Yeah, fantastic. So not only a shout out to your nurse manager, your charge nurse, but to the team. Yeah. We can't say what we're talking about, but when they listen to your podcast, they'll know.
Yeah.
Awesome. That was really, I'm really glad that we talked about burnout. So for those who are listening, I never have a plan, really. I just kind of go where the conversation goes. And that really brought out some important pieces that maybe new nurses don't think is going to happen to them right away, or even seasoned nurses don't anticipate to go through ever. But to hear all those factors that kind of lined up, kind of put you in this position where it was more likely.
For sure.
How did you maneuver out and back towards feeling less burnt out?
I mean, finding something that's not work related in any way, shape, or form, like a hobby or something to do, whether it's by yourself or with friends, just to to help you see, like, my whole life isn't at the hospital. Even though sometimes it feels that way when you're there for 12 hours in a day and you're working a couple days in a row. You basically work and sleep.
That's right.
And I mean, having a good, I would call it a buddy, even if it's maybe one or two people that you can go to vent to, you know what I mean? To have your go-to person, like, this just happened, this is how I'm feeling.
Get the stink out,
Exactly. Get everything out. Yeah, exactly. And I mean, it keeps coming back to the team, right? And just the mix of people that we have on the unit, whether they be male or female. And I've had several coworkers explain that, having those male nurses sometimes on the unit rounds out the unit.
Mm-hmm.
So whether that be attitude, whether it be, perspectives, experiences, that kind of thing.
Yeah.
It really, it helps. Yeah, that's the best way I could describe it. Round out some of those rough edges sometimes that you get with when you get that many people all in the same place.
Yes.
Right.
I have found that as well, that if I work on a unit and it's all women on at the floor at that time, and then the next shift you have a mix of men and women working, the dynamic is different. The interactions are different. The balance, the energy, everything is just different.
For sure. And I mean, everybody goes back to, I love having the guys on the floor. It's some extra muscle power.
That's where I was going to go next. So talk to me about some of those differences you see.
I mean, I've been told, we can't get this NG tube unclamped because we've just pushed it in too far. Can you come and try? Or I can't get this. And I mean, I'm not a big guy, and I joke with patients and coworkers for sure. Say if we're having a difficult patient or whatever, if something's going on, do you want me to go in there and, put the foot down, big, 5'4" Aidan here, I'll strong arm him into making sure they take, they be nice to you guys.
Yeah.
So I mean, it's not necessarily having more bulk and more muscle on the floor. It's the personalities that you bring and the life experience. Obviously, I haven't had anywhere the same experiences, in some cases as a woman of my age, right?
Mm-hmm.
But I bring the other side. Yeah. And I mean, we're still taking care of, you still have 50% of your population that has the potential of not being comfortable with a female nurse, or having a better experience with a caregiver of the same gender or a different gender.
So I was actually wondering that when you were telling the story about the fellow who had the neck fash in the abdomen, and you were assigned to him for such a long period of time, I was wondering, I mean, one, there's continuity of care and that you're able to really work and see the changes, comfort with the same provider, but I was also wondering if there was a connection between a male patient and the nurse who's also male, if that is maybe one of the reasons they kept assigning that patient to you. I mean, I don't know if you know the answer to that. I just was wondering that when you shared the story.
Yeah, I'm not sure, but I think that, I mean, from personal experience, if I'm assigned to, say, maybe like a younger male patient, for example, it's usually like a male, like 40s, early 50s. Mm-hmm. I find that establishing a rapport with them early on is, I want to say, easy. Maybe not easy. I mean, obviously, depends.
To continue learning more about Aidan's journey as a surgical nurse, please go to frontlinenursingpodcast.com, join up as a member, and you will have access to the video interview after the taping interview and a download that has been created just for you. Now, if you have a story you'd like to share on Frontline Nursing, please email me at info@tammydunnett.com so we can showcase your story.